Delays in the NHS impact on healthcare outcomes, patient backlogs and costs. So smooth care transitions are critical to improve performance. The Medworxx patient flow solution has been operating successfully at Royal Liverpool Hospital for several years. We went to find out why optimising the patient pathway by identifying delays and barriers to discharge speeds up the road to recovery.
How are you?
Going home, so quick.
Going home today,
Yes,
great.
yes,
And you've
yeah.
been in hospital for 10 days,
10
is that
days,
right?
yes.
Providing patients with the right level of care in the right place at the right time. It's a challenge for every hospital, and nowhere more crucial than here on the acute stroke ward, where every extra day in bed can be detrimental to an elderly patient's recovery.
We know that even a healthy 65-year-old will age by a decade for every 14 days they spend in a hospital bed. So cutting down those delays in hospital stay and getting people out and back on their feet is crucial to their long-term health. OK, so starting at the top, how are we doing here?
Here at the Royal Liverpool University Hospital, a multidisciplinary team meets twice a day on the ward to record patients' progress. The data is entered into Medworxx, a clinical utilisation software system where it can be accessed by every clinician or therapist in the hospital. The consultant in charge here says Medworxx has revolutionised the way they work.
On a day-to-day level, it will tell me where every patient is up to, who needs to be in hospital, who shouldn't really be here, and what I need to do and who I need to speak to get those patients out of trust.
This is a view of all of the patients within the ward.
Once a patient's information has been entered into the Medworxx system, it can be accessed not only throughout the hospital, but also by other agencies involved in a patient's journey to discharge and recovery.
We're reviewing, from a clinical perspective, every patient every day to determine whether it's appropriate for them to be in that particular bed or not. In order to do this, we use clinical criteria, which is based on international evidence.
Medworxx clinical consultant told me potential delays to discharge, both in hospital and afterwards, can be pinpointed.
It's about patient flow and patient journeys becoming everybody's business. So rather than just the clinicians being in charge of the patient journey, it's about everybody doing their bit.
Here at Royal Liverpool University Hospital, they've increased the number of patients treated by reducing delays in the system using Medworxx. They say it's transformed the mindset here, and working practices follow.
We've just looked at the Medworxx list, and there is 5 on 8X that are ready for discharge. Do you know how many of them are going today?
Those who managed patient flow under the old paperwork system say there's just no comparison.
It would have took all day to find what we can find now in 5 minutes. So we would have walked every ward, of which we have about 30. And we would have looked at every set of case notes. So if you're looking at 24 patients per ward, 24 sets of case notes, 24 people having to look at everyone.
Because our patients become more and more complex over the course of time, in actual fact they're also reliant on more than just one service. So what the pathway and the system actually supports is actually monitoring the patient through that pathway in terms of both health interventions, but also the interventions required around assessment and actually supporting the patient to actually get home.
The Royal Liverpool has been using Medworxx for 4 years, but its Deputy Director of Operations told me there are certain scenarios yet to be tested where the software could really come into its own.
In the future, the Royal could use Medworxx to help with major incident planning and responding to a major incident. It could be a major road traffic accident, an air accident or anything else where a large number of casualties need to come into the hospital at short notice. The Medworxx information will tell us which patients require which types of care and which patients we can safely move in order to create capacity for the newly injured.
What was perhaps once perceived as disruptive technology has led to fewer delays in the system and new ways of planning, resourcing and greater accountability. Most importantly, at the heart of it all, the patient.